This video shows you how to do general trach stoma care. The patient's doctor orders how often to do stoma care and what products to use. Two people should do the care together. Wash your hands with soap and water or hand gel. Clean your work surface with soap and water or a disinfecting wipe. Collect the following items: non-sterile gloves, suction machine and suction catheter, washcloth, water and body soap, dry towel, sterile cotton tip swabs, sterile water or sterile saline, a clean and dry trach tube tie or twill tape, scissors, tweezers, or Kelly clamp if needed, ointments or a protective dressing if the doctor says to use either. Both people put on non-sterile gloves. One person always keeps the trach tube in place by gently holding the trach tube flanges. The other person does the remainder of the stoma care. Remove the trach tube ties or twill tape. Wash the patient's neck using the washcloth, body soap, and water. Dry the neck with a towel or allow the neck to air dry completely. Clean the skin around the stoma. Dip a sterile cotton tip swab into sterile water, sterile saline, or a solution ordered by the doctor. Start at the stoma edge and gently swipe or roll the swab away from the stoma. Do not put the swab into the stoma. Use a new sterile swab with each swipe or roll. Clean the back of the flanges with the same technique, always swiping away from the trach tube. Dry the flanges and the skin around the stoma using dry, sterile swabs. Always start at the stoma edge and gently swipe or roll the swab away from the stoma. Inspect the stoma area. Tell the doctor if you see redness, swelling, or bumps. Apply an ointment or a protective dressing if the doctor says to use either. Trim the band if the trach tube tie is too long to fit the patient's neck. Attach the tie to the trach tube. With the velcro facing up, insert the velcro strips through the holes into the trach tube flanges. Using a Kelly clamp or tweezers may make this easier to do. Press each velcro strip onto the trach tube tie. If you use twill tape, cut the ends at an angle to make them narrower. Insert each end through a hole on the trach tube flanges and tie a knot. Tie the knot in a different location each time you do a stoma care to reduce skin irritation. Make sure the tie or twill tape lies flat around the neck and is not too tight. You should be able to fit one or two of the patient's fingers under the tie or twill tape. Suction the patient as needed during stoma care. Remember, you should suction a trach tube at least once every 8 hours. This helps keep the trach tube open.